Familial hypercholesterolemia is characterized by abnormally high levels of LDL cholesterol. Unlike many of the other hyperlipoproteinemias, this disease is actually really common. In fact, it's the most common autosomal dominant genetic disease. Ever heard someone say, high cholesterol runs in the family? Well, this is probably what they're talking about. So without further ado, I'll share my visual mnemonic for remembering everything you need to know about this disease. For this image, we turn to the local dog grooming center, where things are quite hectic as they prepare for the 3rd annual Barking Beauty Pet Pageant. That's right, we have about 40 pups to clean, wash, and beautify for the pageant, so you might say things are busy. As you probably already know, we have to take off all the pups' collars before they get their bubble baths. See the basket full of collars here on the countertop? Yeah, we definitely don't want to ruin these beautiful collars with some suds. At Pixarize, collars are our symbol for cholesterol. So all the collars here should help anchor you to the disease familial hypercholesterolemia. Get it? A bunch of collars for a bunch of cholesterol? Now, these pups are excitable little creatures, so we keep them occupied with shoo-choo toys. This shoe should help you remember that familial hypercholesterolemia is also known as type 2 hyperlipoproteinemia, because shoe rhymes with 2, right? Whoa, what's that sound? It looks like the faucet in our dog washing area stopped working. I think we clogged the pipe up from using it so much. But now how are we going to wash all these pups in time? The clogged pipe should help you remember premature atherosclerosis, because in atherosclerosis, arteries get clogged up by fatty plaques, right? Kind of like our clogged pipe here. Atherosclerosis is the leading cause of heart attacks, stroke, and peripheral vascular disease. In patients with familial hypercholesterolemia, be on the lookout for patients who have atherosclerotic complications at a young age, like a heart attack in a younger patient. In familial hypercholesterolemia, patients can have MIs as young as in their 20s and 30s. This is similar to what is seen in familial dysbeta-lipoproteinemia. But familial hypercholesterolemia is much more common. Next, take a look at the ladle in our pet groomer's hand. How resourceful. With the water pipe broken, our clever employee is using a good old-fashioned ladle to get the job done. This raised ladle should help you remember that familial hypercholesterolemia is characterized by high levels of LDL. Get it? Raised ladle for high LDL levels? Recall that LDL is the lipoprotein responsible for delivering endogenous cholesterol to the body's tissues. LDL is therefore implicated in atherosclerosis, as it also donates cholesterol to fatty atherosclerotic plaques. This is why LDL cholesterol is also known as bad cholesterol, and this fact is why patients with familial hypercholesterolemia have premature atherosclerosis and subsequent cardiovascular disease. Next, take a look at the ladle holder one of our pups just knocked over. You might even say that this ladle holder is a ladle receptor. Let this falling ladle receptor remind you that familial hypercholesterolemia is often caused by defects in the LDL receptor. With the LDL receptors taken out, the body has no way to clear LDL particles, which is why LDL levels are elevated in this disease. Next, take a look at the tip jar over on the countertop here. Notice anything particularly enticing? Yeah, that's a crisp $100 bill. As it turns out, dog pageants are a really lucrative business. All the owners are rich. This $100 bill should help you remember ApoB100, mutations in which can also cause familial hypercholesterolemia. Get it? A $100 bill for ApoB100? ApoB100 is present on the LDL particle, and it is what binds to the LDL receptor. Together, they allow for the endocytosis of LDL and its subsequent clearance from the blood. Naturally then, mutations in either ApoB100 or the LDL receptor should cause familial hypercholesterolemia. Whoa, what's that outside? Oh man, it's another van full of puppies that need to be cleaned in time for tomorrow. Geez, we have our work cut out for us today. Anyway, this dog kennel van should help you remember that familial hypercholesterolemia is inherited in an autosomal dominant fashion. At Pixar, large, dominant automobiles, like this van here, represent autosomal dominant disease. This is in contrast to smaller automobiles, like smart cars or small carts, that represent autosomal recessive inheritance. Let this large dog kennel van therefore represent autosomal dominant inheritance. You need a big van to transport a lot of dogs, right? This is high yield because familial hypercholesterolemia is so common. In question stems, be sure to watch out for high cholesterol that runs in families. Aw, man, now that the faucet's broken, we don't have enough water to wash out the soap suds in the puppy's eyes. Coincidentally, these suds around the dog's eyes should remind you of corneal arcus. Corneal arcus refers to lipid rings around the cornea, and they result from the accumulation of lipids in the cornea. They're usually found in elderly people, but they can be seen in younger patients with lipid diseases like familial hypercholesterolemia. Finally, take a look at these dog tendon chew toys. These tendon chew toys are our symbol for tendon xanthomas. Get it? Tendon chew toys for tendon xanthomas? Tendon xanthomas are lipid deposits that occur in the tendons, particularly in the Achilles tendon. As far as exams are concerned, tendon xanthomas are pretty specific to familial hypercholesterolemia. While we're here, I also want to mention that there are two subtypes in familial hypercholesterolemia, type 2A and type 2B. In type 2B hyperlipoproteinemia, VLDL and triglycerides are also raised. In type 2A hyperlipoproteinemia, it's just LDL and cholesterol that are increased. I only mention this for completeness. For the most part, you should really think of familial hypercholesterolemia as a disorder of LDL and cholesterol. I'd only worry about the type 2A versus type 2B part if you're shooting for a really high score. Okay, I've got my work cut out for me today, so let's do a quick review before we wash all these puppies down. Familial hypercholesterolemia, otherwise known as type 2 hyperlipoproteinemia, is an autosomal dominant disease that results in abnormally high levels of LDL in the body. This disease is usually caused by a defect in the LDL receptor, but it may also be caused by mutations in the LDL receptor's ligand, ApoB100. When LDL is unable to be cleared from the circulation, atherosclerosis is accelerated. Patients may therefore develop cardiovascular disease at extremely young ages. Other manifestations include corneal arcus and tendon xanthomas. Okay, that's all for today on familial hypercholesterolemia. Hope to see you tomorrow at the annual Barking Beauty Pet Pageant. Or not. You probably have better things to do, being a med student and all. Until next time.